Hi, I'm Warren Kaplan. I am teaching GH885 in the fall. Global Trade, IP, Intellectual Property, and Public Health. It's really important. If you've ever read the newspapers, you see what's happening. People are suing each other for patents. Apple is suing Samsung for patents. A patent. If I have a patent on a medicine, that gives me, for 20 years, I can charge whatever I want for that medicine. I can prevent third parties from making it, using it, selling it, importing it. Therefore, I can charge whatever I want. That has a huge impact on access to medicines, which in part is what this course is about. It's not a law course. Don't worry about that. The trick is, when Merck gets a patent on a drug, they can charge whatever they want, and they will allow people to make it. And in return, they get this little arrow called royalties. Everybody knows what a royalty is. The point is, what happens if we cut this link between patents and price? Because that's what people are thinking of doing. This really slows down access. Who's going to make the meds? If the drug companies don't have any incentives to patent their products and ship them all over the world. So part of the course is about thinking about this link. What would a world look like without patents for medicines? Who would fund these drug companies? Interesting question. The second thing has to do with this business. This is the global framework for all countries who are members of the World Trade Organization to deal with intellectual property. Hugely controversial. It's in the news all the time. India, of all countries, is very, very aggressive in whacking these things. They're knocking these out all the time because they want to make sure that this is not a barrier to access. So this course is about globalization. It's about mostly access to medicines and how this global debate will continue. It's actually never going to go away unless somehow we eliminate patents in the world. And that's not going to happen. So the trick is, how do you manage this tension between the private sector and the public health sector?